It is 8:38. Time now for our Health Watch. As always, joined by Dr. Syed Hussain from Trinity Health in New England to talk about the topics a lot of you are talking about in the world of health. Good to see you.
Likewise.
All right, first off, starting about E. coli. There's been an outbreak now related to McDonald's Quarter Pounders, and that's not the only one. We're seeing some frozen waffles nationwide being sort of recalled because of E. coli poisoning. Should we start by talking about what the signs are specifically of E. coli poisoning or just food poisoning in general? I don't know if they're similar or different or what.
Sure, let's talk about E. coli in particular, and it applies, the same principles will apply more or less to food poisoning as well, Tim. So this outbreak was, we were notified by CDC yesterday that this outbreak involves at least 2 states, but many more possibly, linked to McDonald's Quarter Pounder. Either it's the beef patty or the onions. We don't know yet. It's a fast-moving investigation by the CDC.
Yeah.
Suffice to say, there's 1 person dead, there are 10 hospitalized, and there are 49 and counting cases of E. coli. What are the symptoms? So
yes.
You can have diarrhea, vomiting, stomach cramps. Those are 3 cardinal symptoms that you may have, along with a high fever. Now, what are some of the warning signs? Because E. coli infection, per se, food poisoning in general, is usually self-limited.
Yes.
And you keep yourself hydrated. There's no medications, per se, antibiotics, etc.
Meaning it gets better on its own.
Yes,
you just
it does.
gotta write it out.
But in some cases, there are some red flags that you should always keep in mind. What are those? So high fever, more than 102 Fahrenheit, severe diarrhea that's lasting more than 3 days, vomiting that doesn't allow you to keep anything down, including fluids. These are all warning signs. Bloody diarrhea is also another thing to look out for. All of these mean that you need to contact a healthcare provider and seek medical attention.
Yes.
Because sometimes E. coli, especially the strain that we're seeing right now, can lead to some complications. And like I've mentioned, there are folks that have been hospitalized. So what you can do to stay safe is stay away from those burgers till the investigation gets completed. Practice safe hygiene like we always do.
One quick question. I don't know if it's easily answerable. Doesn't matter so much. Do we know what is usually the time delay between the time you eat the tainted food to the time you start feeling those symptoms?
Great question. So for E. coli, especially the one that outbreak we're seeing, it can take 2 to 3 days for symptoms to develop.
2 to 3 days.
That's right.
Not what people would have thought.
That's right.
Yeah. Okay. All right. So keep that in mind. We do want to talk about the next thing here, clear protein. I just said a couple minutes ago, I had never actually heard of it. Matt Scott walked by and said, I've heard of it. You said you've heard of it too. What? Okay.
I actually use it.
You use it. All right. Well, okay. That's a good endorsement. You're obviously very physically fit. What is it?
I don't know about that, but thank you. I'll take the compliment.
Yeah.
So clear protein basically is, it's from whey protein isolate.
Okay.
It's not the regular concentrate that you see, thick, milky shakes, usually chocolate or vanilla flavored, that are associated with protein shakes. So
yes.
What's different here, Tim, is there's a higher percentage of protein in this drink. It's clear, so the texture is different. It's like a juice.
Okay.
It comes in various different flavors, so it basically boils down to an individual's options of what is available for whey protein and what they would prefer choosing.
Usually whey protein, I think of bodybuilders. I think of people who are going to the gym really trying to build muscle. Is that who should be using clear protein?
So it's a great way to supplement, provide protein supplement to your diet. It's not the only way to get protein. Obviously, there are other methods as well. But it's a great supplement in terms of those that are athletes or actively training who require. The American College of Sport Medicine, for instance, says 1.2 to 1.7 grams per kg body weight per day is what your protein intake should be if you're active, athletically active. So
can't do that math, but
it can help.
Yeah.
But one thing to keep in mind, though, in terms of disadvantages, is that you don't want to have a completely all protein or mostly protein diet, because then you're not going to get the nutrients and the mineral vitamins that the body needs for growth.
Yeah, fats and carbohydrates. You still need some of those. Usually we think of them as just the enemy. They're not. Anything done to excess is going to be too much. All right, well, thank you. I know you already hit the drawbacks too. I'd never heard of it. Now I've learned.